Good morning, ladies and gentlemen. So I'm going to address fillers around the periorbital area or eyeball. There's two types of fillers that people use around the orbit or eye. So that's the eye. One is, of course, the hyaluronic acids. The other one is fat, injected from the lower extremity to the periorbital area. What do I think of both of those procedures? Not much. They don't really work very well. Fat injections can look good for a while, but then they tend to resorb, but they can clump. If they do, they're very hard to fix. Fillers can have what's called a tyndall effect, blue under the skin. They can cause malar bags or excessive swelling due to just inflammatory edema that is very hard to treat. And the skin here, especially, and here, up here, is very thin. So it's not unusual to have a lumpy, bumpy result from either one of those procedures. And again, the problem being, if it happens, not easy to fix. The fillers you can usually dissolve. Fat, you usually have to either try to go in and remove it. Sometimes it will respond to steroid injections, but not always. So my advice, if somebody suggests to you that they're going to do fat injections here or injections of hyaluronic acid here or up here, I would in general decline that procedure. So what can you do? Well, what you can do for a hollowness under the lower lids is a lower lid blepharoplasty using the SOOF technique that I invented and published back in 2000. That lifts the fat that normally occupies the infraorbital rim when you were a kid, teenager, 20s. Falls down here, it lifts it back up, tightens the orbital septum so it gets rid of the puffiness and the hollowness. It is very safe, very effective, and it has a very long period of time that it lasts, doesn't fall apart in 6 months or a year. It stays looking good for years and years into the future. That does require surgery, but if you want something that's going to work and work well and not look lumpy or bumpy or odd, that is really the best way to rejuvenate the lower lid, is not fat injections, not hyaluronic acid injections, but a lower lid blepharoplasty utilizing the SOOF technique that I invented. Upper lids, the volume of the upper lids is pretty unusual to want to augment that. Personally, I wouldn't do it, but there are some doctors that do fat grafting to the upper eyelid. I just find that the indications for that are so few and far between. It's just probably not something that you want to even try, even if you do find somebody that may or may not benefit from it. When you're doing something so infrequently, it's really hard to get that good at it. So that is not something I would do. For most patients that have fullness of the upper lid, if I see 100 of those patients, over 96% of the time it will be due to medial to inferior migration of the brow, filling up the upper eyelid, and that's the segmental endoscopic brow lift. So that's what that is. So you can read about that on my website or look it up on the internet otherwise. And that's it for today.